Been off, well, I've been kind of on paper off, but I haven't really been off. But I'm on this week, so I'm doing it. Q&A. Just had a rant on the Instagram to explain my displeasure at not being able to do this on Instagram, because I know a lot of my followers are on Instagram, and frankly they're suffering because they're not getting my live Q&A. But I'm sure that I'll pull some strings. I've just posted a video which I'm sure will have the desired effect. Also, hot on the heels is TikTok, because I do believe you can do live things when you've got 1,000 followers. Just checked, 600 odd, 24. It said plus 24, so that's up 24 in, I don't know what period of time, maybe a week or a month or something, but not an insubstantial number, I think you'll agree. So clearly the reach is getting out there. And not to mention all my followers on Facebook and YouTube here tonight. So thank you all for being here tonight and giving up your time. It's lovely to see you all. So I've got some questions. If you've got a question, then post away and I will do my level best to answer it. But if you haven't, sit back, relax, and just see what comes your way. First things first. Is that chair in the way of my on-air sign? Yes, it is. That's my rotating chair that's been condemned. So I don't know why I have it there. It's all wonky. Quite like that chair, but there you go. If my tattoo is not suitable for excision due to the size and laxity of skin, could you use a tissue expander to stretch the skin? Good question. Who are these people answering these questions, asking these sorts of questions? Because that's quite an informed question, I would say, and good on you, whoever's asked that question. I kind of feel that's almost a plastic surgeon asking that question. Well, not they probably know the answer, but tissue expansion is a technique of covering large defects that don't have to be covered acutely, that don't have to be covered straight away. So obviously if you've got a big cancer that you have to remove, or a big wound due to trauma or something, we have to cover those straight away. So we have to use certain techniques to do that. But if you have got time, if it's not an urgent or an emergent procedure, then there are other techniques you can use to import large pieces of skin, and tissue expansion is one, where basically you put kind of like a balloon, we'll call it a balloon for the sake of understanding, underneath the skin. You blow the balloon up, that stretches that skin, same as like what happens when you have a baby, basically. Your tummy skin gets stretched, and then you can take the balloon out, and then you've got a whole load of stretched skin that then you can use to cover the defect. And so it is a technique to kind of grow more skin, I guess, because that's what happens when you put skin under tension. More skin kind of grows. It's called the stress relaxation phenomena, and it's a property of skin. When you put it under tension, it kind of grows more skin, if you like. And so the tissue expander is a way of exploiting that. Now, so if your question is, could a tissue expander be used to expand the skin? So what you would do is you would put it next to the tattoo, you would expand the non-tattooed piece of skin, and then you would take the tissue expander out and use that, cut this big tattoo out, and then use that expanded skin to fill the defect. So could it be done? Yes. Simple answer, yes, it could be done. Would I do it? No, I wouldn't do it. For a couple of reasons. One reason is tissue expanders are not good on the limbs. They've got a high complication rate on the limbs, and often tattoos are on the limbs. There are certain areas where tissue expanders work really well. The breast, for instance, a breast reconstruction. So if someone has a mastectomy, they've got a flat piece of skin there because they've had the breast removed, tissue expansion is a really good way of treating that. You can put a bag underneath the skin and you can blow the bag up. The kind of classic, I guess, area for the use of or the indication of tissue expansion is on the scalp. If you have a bald patch, if you have a car accident on an open top car and you take the top of scalp off, and then you have to have a skin graft or something, then you can expand the hair-bearing skin and use it to cut out the skin graft and put hair-bearing skin. Now that's good because it's a specific quality of the skin next door to it, that it's got hair on it, and then you can use that. So a couple of areas where it's good, but it's not good on the limbs. But also, it's quite a big deal, tissue expansion. You might see these people with these weird sort of, they look like sort of, they've got these weird growths basically, because they've got these bags. Sometimes if you have quite a large area, you can put 2 or 3 tissue expanders around the area. You have to come back to clinic every so often, maybe every week, maybe every couple of weeks, to have there's a little kind of buried port usually. Sometimes they're externalized, the ports, but basically there's a little port where you can put a needle in and inject fluid to blow the tissue expander up. So you have to gradually blow it up. It looks odd, and it's also actually quite, and then once you leave it for a while, then you take it out, it's also actually quite often, I find, quite unsatisfactory, the amount of skin that you get from a tissue expander, and you often have big dog ears, big bumps where you've turned the skin over to fill the defect, and it's quite an involved procedure. And in sort of answer to the question, if someone says, would you use a tissue expander, my answer would be, my preference would be not to use a tissue expander. My preference would be to do a serial excision. So you might have heard me talk about serial excision before, where you cut a piece of the tattoo out as much as you can, really tight. You leave it 4 months, and then you can cut more out because it's not tight anymore. That's relying on the same concept as tissue expansion. So it's utilizing the same quality of skin, that when you put it on tension, it grows more, but it's doing it in a different way, and it's doing it in what I would say is a more kind of less complications and sort of easier to deal with way than putting tissue expanders under the skin. You know, it's quite intensive thing to use a tissue expander. As I say, people have to come back to clinic regularly. There's a high complication rate, complications being things like extrusion and things like that, not to mention the physical nature of having a big plastic bag underneath the skin, or balloon or whatever. And so I feel that serial excision is a better way to remove most tattoos. I've certainly never used a tissue expander for a tattoo removal, and it's not high on my list of ways that I do it. And it's a very personal thing. Like last week or the week before, sometimes talk about skin grafts. You know, some people might do skin grafts. Personally, I don't do skin grafts. Personally, I don't do tissue expanders. You know, I do excision, which is just cutting around and stitching them up, which is sort of the mainstay of it. But if it's too big for excision, then serial excision, which is taking as much as I can and then coming back 4 months later. And as I say, it's the same concept of tissue expansion, but in my view, fewer complications, less kind of intervention, and less kind of a more manageable from a patient side of things. Both in terms of the amount of times you have to come back to clinic, and also in terms of the fact that you have a big bag you have to deal with that's can be a bit uncomfortable and can look odd. So for all those reasons, my preference is serial excision rather than tissue expander. But as I went back to the beginning of the question, can you do a tissue expander? Yes, you can. It can be done, and there might be someone out there who's doing tissue expanders for large tattoos, but I'm not him. So yeah, good question. I like that question. Well done you. How soon after explant surgery can you have implants? So one must presume we're talking about breast implants, obviously. What other implants were we talking about? Well, I guess it kind of depends on why you're having the implants out. I mean, if you're having it out for infection or something like that, obviously you want to make sure the infection's all cleared. But if you're just having them out because you want them changed, personally, I will do a change of implants. I will take them out and put the next ones in at the same time. So unless there's a reason not to do it straight away, you know, because kind of if you're asking that question, you are kind of, this is a patient who's, well, maybe they've already had an explant, but you know, if you haven't had the explant, I'd be like, I would put them out and put them back in again at the same time. There might be a reason why you wouldn't do that, and infection's kind of like the obvious one. But let's just, so that's the first thing. I would often do it kind of immediately in the same operation. But if for whatever reason there's a reason not, if the pocket's not right or there's some issue or something like that, fair enough. I'll answer the question in that case. I'm going to say 4 months. It kind of depends a bit, you know. It depends on how things heal and everything. If it doesn't heal up properly, if as I say, there's infection around the area or something like that, then you might want to leave it a bit longer. But 4 months, 4 months, I say, would be a good ballpark, and that will be kind of like the minimum, because you want that scarring to settle. You want the scar tissue underneath the skin all to soften and settle. From a surgical point of view, the longer you leave it, the better. So the longer you leave it, the more supple those tissues get, the more supple and soft that scar gets, the better. So really, from our point of view, we kind of want to leave it as long as possible. The surgery is a lot easier the longer you leave it. You know, if you go in too soon, the surgery is not very easy. I used to do things around 3 months. I'm thinking more about serial excisions and things now, but it's the same concept, you know, going back in to a surgical field. And it's just not, it's, you know, 4 months as a ballpark, I think, is a better ballpark. But it is a ballpark, you know. It might be longer, it might be shorter if everything heals really well and it's lovely soft and you've got reasons to get it, you know, get on with it. You know, it might be 3 months, but I'd say 4 months is a ballpark for me anyway. As a general rule. Can you repair an earlobe if it has not completely split all the way down? Yes, you can. For sure you can. And it's not uncommon for people who want to have that repaired. So that would be like an enlarged earring hole, I guess, if it's not quite split. And people often, because of the sort of back of the kind of the butterfly of a stud or something, they can fall through and the earrings fall out and things. So people often want earring holes reduced, shall we say. And the ins and outs of how we do that would depend on each person. If there's kind of like a really tiny little bridge of skin, sometimes it's as easy to complete the split and then repair it as if it's a complete split. But if there is a fair bit of skin left, then we can just reduce the hole, and that would be something we'd assess. But the principle is, yes, you can repair an earlobe if it's not completely split. You can reduce the earring hole. And the principle we do the same as a split earlobe as to whether you would want to keep the hole or have it re-pierced elsewhere. And it's always easier to have it re-pierced elsewhere. Although if you really wanted to sort of keep using that hole, there are techniques you can use to mean that you can still use that hole, although it will always be weaker than a kind of fresh piercing elsewhere on the lobe. But these discussions we can have. But in general terms, yes, you can repair an enlarged earring hole or a not quite fully split earlobe. Can we remove a fibrous papule? Yes, we can. I guess it depends where it is. Sometimes they're kind of intraoral or on a mucous membrane that we might, like inside your eyelid or something like that, we probably wouldn't want to get involved with. Inside your mouth, probably say, look, Max Fax for that. Eyelid, maybe an ophthalmologist. But yeah, I mean, the general thing and the way that we've structured this thing when we do this see and treat clinic is that the reason we can do it, well, there's two reasons. The first reason is we've got our own minor operating room in the clinic, which is kind of just ours, just mine. It's not like a hospital which has got a minor operating room which, you know, on any given day could be used by any surgeon. So you can't just go to an outpatient appointment and say, oh, can I have this removed today? Because they'll be like, well, the operating room's been used by someone else. But in our clinic, we just got one, you know, it's our operating room. So we've set it up so we're available to do the procedure on the day. So that's one reason we can offer the see and treat clinic. But the other reason, which is we found really good, is we ask people to send us a photo and maybe a bit of background as to what the lesion is, because then we can give you an idea as to whether we can do it or not. Because obviously, if we say, oh, it's Max Fax or it's ophthalmology or some other surgeon, or we might not be able to do it, then it saves you having to come, you know, for a see and treat appointment. And also if you send us a photo, we can give you an idea whether we can do it or not, and also a price. So you don't have to, think, oh my God, what's we going to? So therefore, if we can give you an idea whether we can do it or not, and we can give you a price, then you've usually got a pretty good idea whether you want it done or not. So it saves you having to come for a consultation to discuss it and then come back to have it removed. So that's kind of I'm not going to say revolutionary, because I mean, see and treat clinics do exist, but it's one of the things we're really pushing. And actually, you heard it here first, I'm making a new website. I'm in the process of it. I've been a bit set back because of the those IT problems, all the internet problems and things, but it's called seeandtreat.co.uk, and it's focusing on, because what I want to do at the clinic is do more. We're moving more towards, well, the minor op, the clinic, the moles assist. That's kind of what I'm transitioning to. I'll be honest with you, I'm doing more of the moles assist, the local anaesthetic cases, and that's something I want to try and focus on at the clinic. So yeah, fibrous papules is up there with a lump and bump, but as I say, we'd have to see where it is, and get a little bit of history, send us a photo, and then we'll give you a bit of an idea of what it would cost you if we did do it, and whether we could do it at all. Bit of a breather there. Halfway in, not quite halfway in. It's the last question, I'll be honest with you. So for goodness sake, if you've got a question, get it in, because this is the last one. All right, this one here. Can we correct Stahl's bat ears? So bat ears, terrible name, I know. Shouldn't, not great, is it? But a Stahl ear deformity, should we say, a Stahl. So ears is one of those things, one of those operations that kind of like, a bit like breast implants in a way, I suppose, that all plastic surgeons do it, really. It doesn't matter what your specialty is, all plastic surgeons do it. There's very few ear specialists in this country. There's like a handful of people who specialize in ears, and they'll do like ear reconstruction for people who've born without an ear, and quite significant things. And so kind of like a prominent ear, prominent ears is a very common complaint, and we do prominent ear correction. I say we, I don't do it. The other surgeons at the clinic do it, but it's a standard. I used to do it, but it's a standard thing that pretty much all plastic surgeons will do. But a Stahl's ear deformity is not a standard prominent ear. It's a deformity of the cartilage of the ear, and it's more complicated, and it's probably going to be a ear specialist. So it's another one of those ones where I'd say, look, send us a photo, we'll have a look, and we'll get the guys who do the ears to have a look at it. But just in general terms, a Stahl's prominent ear or a Stahl's ear deformity is, I would say that's usually an ear surgeon. The one we have here in Birmingham is Mark Lloyd. He used to work at the clinic, doesn't work at the clinic anymore. Not sure. I think he's gone part-time and things like that, but he is an ear specialist. That is his kind of subspecialty. Interesting, I say, he's one of the few in the country that actually specializes in ears. But there are others, but they're literally dotted about this. And I would suggest that a Stahl's ear deformity would be best treated by an ear specialist. But as I say, if you have, I mean, you might not know you've got a Stahl's ear deformity. You might just say, I don't like the look of my ears, sort of thing. So it's always best to send us a photo, and we'll say, look, well, what we can do. We say, look, that's fine, we can do that. That's fine. You just need to reshape the cartilage and do what we do with the prominent ear correction. But it's a Stahl's ear deformity. That's a little bit more complicated, and probably will be an ear specialist, I would suspect, if it is a Stahl's ear deformity. But there's ranges with all these things. So that's it. Well, thanks for your time. Next week I might be away, so be here the next couple of, I don't know when, but I'm sure Chef Bezos will have seen my message about Instagram, so no doubt I'll probably be back on Instagram by then. And who knows, might have 1,000 or 100, no, whatever you need, TikTok, 1,000 TikTok subscribers or followers or whatever. In which case I might be on TikTok as well, but I don't know if I've got enough devices to do TikTok and Instagram. But anyway, we'll get over that. We'll get the IT department looking at it. If you have any questions, just put them in the comments, I suppose, or email us or contact us somehow, and do my level best to reply to them. But if not, then you haven't got any questions. So just be happy that you're comfortable with your life and you haven't got any questions. So we can only envy you. But this is really for those out there who've got questions, really. So if you haven't got questions, what are you doing here? That's my question to you. I've got a question to you. What are you doing here? So we've all got questions, haven't we? Okay. So maybe I've got to work on how I end these. But yeah, that's it then. So I'll bid you good night, and I will see you next time.